A doctor's skills can determine the patient's health and safety. Having chosen this path, we cannot take it lightly. Without sufficient expertise and knowledge, how can we treat patients in the future?
I solemnly pledge to dedicate my life to the service of humanity. I will practice with conscience and dignity. The health and well-being of my patients will be my primary concern. These are the mission and core principle of Tong's Taichung Metro Harbor Hospital. In 1961, Ray Ching Tong graduated from the National Defense Medical Center. After completing his 10-year training at the Taichung Armed Forces General Hospital, Ray Ching Tong returned to Shalu, Taichung to serve his hometown. On October 24, 1971, he founded Shalu Tong's Hospital, the predecessor to Tong's Taichung Metro Harbor Hospital.
Back then, hospitals in the remote countryside differed from those in the cities. There were very limited surgeons and hospital beds available for rural patients. Shalu was no different. As such, one could imagine the challenges my brother Ray Ching Tong faced when he founded the hospital.
Ray Ching Tong led by example and strived to hone his medical skills. In addition to being licensed in internal medicine, Dr. Tong also successfully obtained further licenses in surgery, obstetrics and gynecology, pediatric surgery, pediatrics, cardiology, gastroenterology, emergency and intensive care, gastrointestinal surgery, endoscopic surgery, endocrine surgery, and critical care. Dr. Tong became a rare all-round doctor with 11 medical licenses spanning a wide range of subspecialties. Tong Hospital was founded at a time with limited resources in Taiwan. Dr. Ray Ching Tong was frugal and expected his nursing staff to be the same. For example, there was not to be a drop of alcohol or other disinfectant solution dripped to the ground from cotton balls. All nurses developed thrifty habits under his strict training. He also invested heavily in hospital equipment for patient care despite the limited financial resources. What I remember off the top of my head is an elevator for patient transport. However, elevators at that time were prone to breakdowns when frequently used. Dr. Tong would take the stairs to reserve elevator use for patients or persons in need. When the staff saw him do that, they followed suit. In the early years, medical technology in northern Taiwan was more advanced than that of central Taiwan. We tried to interact and learn from doctors from hospitals in the north, such as those from Tri-Service General Hospital, Taipei Veterans General Hospital, and National Taiwan University Hospital. Tong's Hospital would also seek help from well-known doctors to help with complex cases. Our medical staff never ceased to improve their professional skills. Ray Ching Tong had set up a small tea room in the basement of the hospital, around 14 to 15 square meters in size. The Tong brothers all had different duties at the hospital. Ray Ching Tong and the fourth brother, Ray Nian, were in charge of medical practice. The third brother, Ray Nan, general affairs. The fifth brother, Ray Long, public relations and administration. And the sixth brother, Ray Yang, medical instruments maintenance. After work, the brothers would meet in the tea room for discussion, feedback, or brainstorming. If patients or their family members needed immediate medical help, they would go to the tea room. No matter which brother was there, he would provide assistance right away. Medical resources were still relatively scarce in central Taiwan, and Ray Long and Ray Yang often drove the ambulance to transport patients for further medical treatment at major hospitals in northern Taiwan, such as NTU, Taipei Veterans General, and Tri-Service General. One of the staff in billing remembered that Dr. Tong tried to keep fees down while also making it flexible for patients to pay. For patients with financial difficulty, they would only note on the medical record the total fees and date of each visit, but they never pushed these patients for payment. Tong's Taichung Metro Harbor Hospital was the first hospital to allow hospitalization and surgery without collecting a security deposit. Pong's Taichung Metro Harbor Hospital Formosa SOS International Medical Transfer Service is an innovative overseas emergency medical rescue brand created by the Taiwanese. It has the most professional acute and critical care aeromedical team and the most comprehensive aeromedical equipment. With a simple phone call wherever the patient is, Formosa SOS is immediately deployed for medical rescue and transfer to treatment access within the golden hours. We are committed to international medicine by providing cross-border medical care to facilitate foreigners seeking medical treatment. Our high-quality medical services also attract medical staff from abroad to exchange programs at our hospital. Cerebrovascular disease is one of the leading causes of death and disability in Taiwan. Having a stroke patient in the family not only affects the quality of life of all family members, but also subsequent medical costs and care also place a heavy burden on the family. Our stroke center, formed by a multidisciplinary team of specialists, provides prompt diagnosis and offers immediate and continuing care with a holistic approach. We offer 24/7 acute phase stroke treatment, including venous thrombolytic therapy and intra-arterial thrombectomy. We also provide post-stroke care, a rehabilitation program, and counseling during subsequent phases. From congenital heart defects to adult cardiovascular disease, our hospital is equipped with cutting-edge medical devices for cardiac evaluation. The Cardiac Catheterization Lab, the latest Da Vinci robotic arm surgical system, and hybrid operating room all allow our cardiologists, pediatric cardiologists, and cardiovascular surgeons to provide prompt diagnosis and appropriate treatment. It is the cooperation of our specialized medical team and incorporation of innovative and cutting-edge medical technology which allows us to provide complete medical services and emergency care for cardiovascular disease patients of all ages. The Da Vinci robotic surgical system takes surgical procedures to a higher state of precision, substantially reducing the possible risk of complications. The Da Vinci robotic arm surgical system is fully integrated at our hospital, combining intricate medical skills with advanced instruments, bringing high-quality medical care to our patients. In addition, we also provide Da Vinci surgery case observation programs to doctors in Taiwan and abroad to benefit even more patients across the globe. To fight for prime medical treatment time for critical trauma patients, our hybrid operating room provides a one-stop surgical environment. The room is equipped with several pieces of state-of-the-art imaging equipment, such as slider-type CT, computer tomography, and ARTIS Pheno multi-axis angiography system. This is a time saver as it cuts down on the time required for information transfer between the imaging department and the operating room, so doctors can precisely operate on or treat the patient immediately. At the Dagwon Surgical Demonstration Center, remote video conferences and observations, real-time discussions, and exchanges between the trainees can enhance learning. In order to improve laboratory testing performance, our hospital has an intelligent laboratory. It utilizes AI, combining software and hardware equipment to integrate modularization and information technology. As we continuously update equipment and improve processes to fine-tune complex laboratory testing procedures, the laboratory has completed the TAF accreditation and passed the USCAP rate survey. Organ transplantations are the only hope for many patients to regain their lives. In 2003, we established an organ donation and transplantation committee. In 2004, we completed our first liver and kidney transplant. Since then, the number of transplant cases has increased every year. Our patients' post-transplant 5-year survival rate is higher than the national average, and in 2018, we completed the first living donor liver transplant with incompatible blood types. For half a century, we have made outstanding achievements in acute and critical care, disease care, cancer care, health care, and health management, and placed equal emphasis on clinical, teaching, and research. We are certified by the Ministry of Health and Welfare as a critical emergency responsibility hospital. Our acute and critical care teams include ER, acute stroke, acute coronary heart disease, emergency trauma, high-risk pregnancy, neonatal care, and an intensive care unit. To provide more comprehensive care and respond to the trend of minimally invasive medicine, the 6 interdepartmental teams continue to bring in the most advanced medical equipment and technology. In cancer care, we have the Cancer Center and Cancer Resource Center. Integrating screening, treatment, and follow-ups, we provide long-term care and services for patients. In terms of health care, our prestigious Child Development Center and Child Development Joint Outpatient Services implement the concepts of holistic and continuing care for the individual, family, and community. For health management, our Premium Health Examination Center provides customized health exams. The attending specialist physician personally explains the reports, and follow-up healthcare services are arranged by a health manager, providing the most exclusive guardian of health.
No matter the medical progress, the advancement of medical instruments, the development of various medical treatments, we still need humanity in the end, and hospital visits need warmth. So we still emphasize this part in our medical care. We are still patient-centered. We want our patients to feel that we have not only healed them, but we also want to let them feel warm and cared for.
Due to the efforts of successive superintendents, Tong's Taichung Metro Harbor Hospital has become the most powerful guardian of health for residents in the coastal regions of central Taiwan, and its medical capabilities and quality have received international recognition.
This year, 2021, is the 50th anniversary of the founding of Tong's Taichung Metro Harbor Hospital. Over the past 50 years, we have grown from 3 employees to nearly 3,000. The efforts of past hospital superintendents and all of the staff have allowed us to gain acknowledgement from our fellow townspeople and patients. For the next 50 years, I want to follow in the footsteps of the past, whether in AI information technology or big data applications. In the future, we will also establish postnatal care, a cell therapy center, and a geriatric daycare center. These are all to make our medical system more complete. For an enterprise to grow, everyone, no matter business owner, senior executive, or staff, must keep pace with the times. So we spare no effort in investing in educational resources. A patient-centered care system, with the introduction of new medical technology, is the new future of our hospital.
Tong's Taichung Metro Harbor Hospital will uphold our founding principles with deep roots in Taichung and continue to meet international standards. We will be your most trusted and heartwarming hospital.